Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. You've heard about rheumatoid arthritis tests, and you're wondering what they cost, how they actually work, and how to order them online in 2026. Here's what Mayo Clinic and the NIH actually say. If you're researching whether RA testing makes sense for you or a loved one, this video breaks down exactly what blood tests detect, how much they cost, and what to do with the results. We'll cover the specific markers clinicians look for, where to order online, and how to interpret results with your healthcare provider. Rheumatoid arthritis is an autoimmune condition where the immune system mistakenly attacks joint linings, causing inflammation. According to the Cleveland Clinic, RA is different from osteoarthritis. It's systemic, affecting multiple joints and potentially other organs. The NIH estimates about 1.3% of the U.S. population has RA. What matters for testing? Early detection through blood work can catch disease activity before major damage occurs. Blood tests don't diagnose RA alone, but they're essential because certain markers show up weeks or months before symptoms appear. Blood tests help detect inflammation markers and antibodies linked to RA. Mayo Clinic explains that these tests are typically the first step when RA is suspected. Why? Certain blood markers appear before symptoms develop, and they help distinguish RA from other conditions. Medline Plus notes that blood tests also track disease progression and show whether treatment is working. The tests are quick, relatively affordable compared to imaging, and can be repeated over time. This is why clinicians order them early. They provide objective data that symptoms alone cannot give. The two most common RA tests are rheumatoid factor, RF, and anti-CCP antibodies. According to the NIH, RF has been used for decades to detect antibodies that attack the body's own tissues. Anti-CCP, discovered more recently, is often more specific to RA. Mayo Clinic notes that both tests together give clinicians a clearer picture than either alone. Some people have one marker, but not the other. That's important information. There are also inflammatory markers like ESR and CRP that show general inflammation. Your clinician orders the combination appropriate for your situation. Beyond RF and anti-CCP, the NIH mentions C-reactive protein and erythrocyte sedimentation rate, CRP and ESR, which measure inflammation generally. Anti-nuclear antibodies, or ANA, might also be tested because other autoimmune conditions sometimes coexist with RA. Cleveland Clinic points out that thyroid function tests are often ordered too, since thyroid disease and RA frequently occur together. Not every person with RA has all these markers. Think of it as a panel where each test adds information. Your clinician uses these patterns to understand what's happening. Medline Plus explains that rheumatoid factor is measured in international units per milliliter, IU/ml. The typical reference range is below 14 IU/ml, though ranges vary slightly between labs. Anti-CCP is measured in units per milliliter, with cutoffs often around 20 units. But here's critical. A positive test doesn't guarantee RA, and a negative test doesn't rule it out. Mayo Clinic emphasizes that results are interpreted alongside your symptoms, physical exam, and imaging. That's why discussing results with your clinician is essential, not relying on numbers alone. Costs vary depending on where you test and your insurance. According to recent data, an RA panel and anti-CCP typically runs $50 to $500 without insurance, depending on the lab and region. Adding inflammatory markers can bring totals to $200 to $800. With insurance, your out-of-pocket cost depends on deductible and copay. Quest Diagnostics and LabCorp publish cash prices online. Smaller labs sometimes offer discounts. The NIH recommends calling ahead to ask about pricing, especially if you're paying out of pocket. In 2026, ordering RA blood tests online is straightforward. Companies like Quest, LabCorp, and telehealth platforms let you order directly without a clinician's order, though this varies by state. Most workflows are simple. Create an account, select your test panel, pay, and schedule your draw at a local lab center. Some telehealth companies pair blood work with a consultation call, so you discuss results with someone. Medline Plus lists reputable options, but verify your lab is licensed and certified with proper quality standards. When results come back, positive markers suggest inflammation and autoimmune activity, but they don't equal a diagnosis alone. Cleveland Clinic stresses this repeatedly. Blood tests are one piece of a diagnostic puzzle. You might have positive antibodies, but no symptoms, or symptoms but negative tests. That's why the next step is a conversation with your clinician, preferably a rheumatologist. They'll review your medical history, do a physical exam, ask about joint symptoms, and possibly order imaging like X-rays. If your tests show positive results, or if you're exploring whether RA testing makes sense for your health, the next step is scheduling a follow-up with your doctor or a rheumatologist. They can discuss what the numbers mean for your specific situation. Don't panic if numbers are elevated. Many things trigger inflammation. Blood tests are a tool, not a verdict. We've linked resources from Mayo Clinic, the NIH, and Medline Plus in the description for more information on RA testing and next steps. What type of health tests are you interested in? Comment below and we will make a video about it.